is Amy Monaghan with EHR TV at HIMSS 2012 in Las Vegas. Today I'm with Jean Boerger, Vice President of Professional Product Management for Emdeon. Welcome and thank you for being with us today.
Thank you for having me.
Can you start off by telling us a little bit about Emdeon?
Sure. Emdeon, we are the largest healthcare transaction processing company in the United States. Last year we processed 6.4 billion healthcare transactions.
Okay.
And so we have historically been a clearer of transactions. We're best known for formerly our clearinghouse services, but we have been able to significantly change our model because of our interconnectivity and our interoperability that we have really across all EHRs as well as hospital systems. So it's a unique place to be where everybody's trying to connect their providers and we have the connectivity and that's not really how people think of our business. So it's been a change in how we actually roll out, how we actually let people know what's available and what we can do for them.
Okay. I noticed that you joined the Interoperability Showcase this year.
Did.
Can you tell me a little bit about that and how it's working out for you?
The Interoperability Showcase is, if you've never been there, it's just a great place to really look at how different disparate systems can work together. Our focus this year, we helped with legislation along with HIMSS and a number of other organizations in order to get legislation for electronic payments and electronic funds transfer for physicians. It's the we all think about in our lives, our banking and everything we do electronically, and only 10% of healthcare payments are actually made electronically.
It's very interesting.
So we helped with the legislation. We also, because we are a large print processor, outsourced print shop processor for approximately 700 payers, we're processing and sending their checks. So we can convert that into electronic funds transfer on behalf of those payers and those providers.
Oh, that's fantastic. What other things are you showcasing or really focusing on at HIMSS this year?
Well, our real focus at HIMSS is really about understanding all of the information that flows through our network. We're really almost an EHR in the cloud, so to speak, in that we have all this data that flows through the system. So an example is the work we're doing with the American Academy of Family Physicians. Great pilot project. What we've been able to do with them is build analytics on the data. They've identified and built the analytics on data that's already flowing through our system. So unlike a traditional kind of program, they call it their clinical data repository. Unlike a traditional program where you would collect data, where you would identify what you want to do and then collect data in order to try to do it, we already have the information. So we can focus on outcomes, we can focus on gaps in care, and less on how do we actually get the data to see if this concept will work.
Very good. All right, well, thank you so much for taking the time to be with us today. This is Amy Monaghan with EHR TV at HIMSS 2012.